to another episode of the Agent Boost Marketing Podcast. I kind of feel like this is turning into lately the Medicare or health insurance news network with the breaking news dropping all the time. So we're just going to spend a little bit. We want to get back to some actionable.
Did you ever watch that show on HBO, The Newsroom?
No, it looked boring.
Not Jeff Daniels. It was
okay. I remember a little bit of it.
We're not quite the newsroom. We're not saying that. I was just sorry.
Yeah, there's a lot of healthcare industry news dropping lately, so we're going to cover that a little bit for the first few minutes. Then we're going to talk about some sales-oriented initiatives for tips and tricks of what we would do as agents if we were kind of starting over, and some passive versus active marketing. So to start off, a couple pieces. Steward Health Care announced that they're filing Chapter 11 bankruptcy.
Yep.
And they operate health systems. They have 30 hospitals in 8 states.
So Massachusetts, Boston, big, Utah. I mean, I don't know them all off the top of my head. You probably do, or you can cheat. But
yeah, I mean, they're mostly in Massachusetts, and so I think Texas as well. We just kind of snicker a little bit just because at a time, Steward also had a health plan, a small Medicare Advantage plan that was a misguided.
We performed some services for them, or attempted to for a number of years, and so when I heard the news, I was like, oh, okay, so they're going bankrupt, but
it's more again of a bellwether of a broader industry problem that I think we wanted to kind of talk about the
yes. So it's not going to be just them. So like lately in the news, if you actually read, I'm one of those nerds reading things from like Modern Healthcare, reading Becker, reading, I'm really, my fun and entertainment is when I can, sit down and read an article for 30 minutes or an hour and not have like my, kids driving me crazy or something like that. But I love this stuff. So, I mean, what we're talking about is, Steward's not the first and they won't be the last, with everything going on. There's just so much leverage right now going on with PE firms and acquisitions. And look, leverage is like the name of the game with PE, right? But what's happening in healthcare and health insurance and carriers, though, is there's all these restrictions in place anyway to kind of prohibit or prevent certain amounts of profitability. And so when you're running businesses with like MLR ratios, or there's, regulations put in place that, like you'll say in the insurance industry or Medicare, where they say, hey, 85 cents on the dollar of every dollar you collect has to go into providing benefits for an insured. That only leaves you 15 cents on the dollar to pay for all of your administrative expenses, technology costs, like you name it, broker commissions, FMO fees, it all squeezes under that 15 cents on the dollar. So your profitability is limited anyway. And so you're only
percentage points here and there.
Yeah. So like when for example, I'm just using health insurance companies, but healthcare is very similar, but you only have a couple percentage points of profit. That's why a 1 or 2% swing from one carrier or payer from one to the other is massive.
Yep.
But it's already just such a game of margins. So when you're deploying like these PE strategies of leverage to these, firms, it's causing a lot of disruption.
Yeah, and just kind of what's happened over the healthcare industry in general over the past 10 years, and it's really escalated, pre-COVID and then after COVID, is so much rolling up of the healthcare industries, the centralization of doctor networks, of these IPAs and these hospital network groups, and private equity groups essentially come in, make these acquisitions, strip out a lot of the profitability, and then are unable to function in the way that they need to as these hospital networks.
Yep. So that's happening, but I would say look for more of it. And now it's interesting too that now regulators are kind of putting out there kind of like, oh, we are becoming more aware or lucid, or we're now understanding that there has been a lot of lax or not a lot of oversight on a lot of these acquisitions. And so they have maybe not been looking at antitrust as much as they should. So I would just say that while I think there's going to be a lot more happening, I think it was funny because I think on the podcast last week we talked about look for more of this to come. Mm-hmm. Here it is 1 week later, and this is just one. I think you're going to see other medical hospital systems collapsing over this next year. More consolidation like we're talking about, but deals getting done are going to become harder because I think they're going to start to look at antitrust more.
Yeah, and ultimately, I consider myself a a fiscal conservative capitalist, and I do think there comes a point, especially in healthcare, where a lot of, rolling up of everything isn't necessarily always good when it comes to a lack of diversification of thought, when it comes to a lack of competition, and it becomes these environments of, if you can't, beat them, join them type of thing, especially in, of all things, of all industries, healthcare, and the quality of that we're providing to the consumer is probably not there like I would hope it would be. And I think a lot of people don't actually understand how many of these hospital groups and hospital systems and doctors networks and groups are ultimately, owned by private equity or corporations that roll everything up at the top. Mm-hmm. And essentially the vast majority of our healthcare system are employees of these private equity firms or large corporations. And these doctors are essentially implementing the game plans of the corporation, and they don't have as much autonomy, and there's not as much diversification of thought and care as I think there used to be. Finding
some standalone, independent, solo practitioner or physician out there who has his front office staff doing billing and claims, and that is almost, a thing of the past. Yep. It's rare to find that.
Yeah, so there's probably going to be some more of these hospital groups that are struggling. The good news is they're filing Chapter 11. They're going to be, reorging. They're not gone. There's not, we can't really afford capacity to be diminished, especially in a lot of those markets when some of these systems go belly up. But
there will be a buyer. So, and who is going to be the buyer? And that's the big question. Who has the balance sheet? Who wants to buy 30 hospitals right now? And, we'll have to watch to see who can be those potential buyers, and will it clear antitrust? And again, if it's, a health plan that, you could see how that could give them, somewhat of an advantage.
Yeah. So, hopefully we see less of these entities kind of going belly up, but just the way that the economy is right now, we're really on a razor's edge of a lot of things. I think there's a lot of entities and organizations across multiple industries that are really kind of holding on, and some of these
feeling the squeeze.
Yep. Some of these shifts that happen in the industry are just kind of, pushing them over the edge. And, to your point about saying there's going to be more of these to come, I went back and listened to some prior podcast episodes from last year, and we're doing pretty good.
Right?
Yeah, we're doing pretty good on some of our
predictions,
some of our predictions and analysis and predictions from the call letter and fallout and things like that. So hopefully we can continue to offer some insight. So let's talk about
before we go into sales, a couple other things I want to talk about, just quick ones to throw out there. Shout out to Oscar Health, who for the first time ever had profit in a quarter.
Yep.
So, I mean, that's better than some, because there's carriers out there that when you look at their earnings reports,
especially on the ACA with the chaos going on right now,
you look at some of their earnings reports and they're like, oh, their net operating loss, their operating loss for the quarter was less or reduced. You're like, oh, okay. So, they only lost $40 million this quarter, but there's a lot of carriers out there in worse positions. So, Oscar, which, we contributed to that, we wrote some of that business. So, anyways, they post a profit. That's great. The other thing I haven't had a chance to really read up on it is we had talked about the Change Healthcare hack that happened. And, if you heard, their CEO, Witty, when they were asking him about how many people were impacted by that hack, he was like, we estimate, 1/3 of Americans. Only 1/3 of all Americans, huh?
Reminds me of that Biden sound bit. Somewhere between 1 million, 100 million, billion, bajillion stammering numbers. That's like how many people were involved.
Like 1/3, 1 out of every 3 Americans. You're like, oh my. And the reason being is you didn't have to have United Healthcare as your insurance to be hacked because of the risk management that they're providing with Optum and, the pharmacy, because that tool, the pharmacy tool that they were using, and then eligibility lookups. And there's a lot of other systems that they plug into. And so you're like, oh, that doesn't impact me because I don't have United Healthcare. Wrong. A lot of people their data was compromised. So I think that went a lot further than people realized.
And then we just saw breaking before we got on here that Ascension just was hacked. So hackety hack, everyone's hacked. All your data's hacked. We're going to get new MBIs.
Ascension is part of Centene, you know, and so, yep, now there's a big hack, and that was just, like I said, you said it's just a article or a headline. It was 2 hours ago, so we haven't had a chance to read up on it yet, but.
Yeah, it'd be interesting to see if because they're the Medicaid connections there through like change and the verification, if there's just been exposure that's going to continue to creep.
Yep.
But anyway, let's talk about one last kind of big piece of news that I thought was interesting. Again, to that point, Andrew Witty, the CEO of United Healthcare, he's kind of putting the message out to the market that the next 3 years for Medicare is looking, he's calling it a Medicare squeeze.
Yep.
And it's interesting for me because we've been in this game for a long time, and I've never seen this early on in the year the carriers communicating basically like brace yourselves. It's like that
Hedging so early.
It's the Game of Thrones meme with Eddard Stark, you know, the brace yourself meme.
Yep.
Right? That's brace yourself for
Winter's
Medicare.
coming.
Yeah, winter is coming in the Medicare space. So we're going to, you know, everyone keeps messaging out a little bit of pullback on the plans. He's basically saying, you know, the funding environment and profitability doesn't look amazing for the next 3 years. And so he's just kind of setting the tone, setting the table for this coming AEP and things to come.
Yeah, and just to tack onto that, the other thing that people don't realize is I've had a lot of, and we've mentioned it before, so just remember, I've had a lot of people make assumptions about, you know, it is an election year, an election cycle, and it's like, oh, well, if we get a new administration and there's a new kind of leadership change, then this is going to be rolled back or some of this will change. And it's like, well, you know, it doesn't really work like that. I mean, yes, we could get a new administration. If they do, conceivably, they'll have a much different path and they'll want to change things and repeal things, but all those things take time. So again, we're going to have to, like, he's basically like Andrew Witty, the CEO, is basically saying, like, based on everything right now, like it's already, the path is already set forth, right? For the next couple of years, it's already in motion. This is what it is. So even if you get a leadership change, you can't just like snap your fingers and change it. It's going to take time to craft like those ideas, to get them passed, to get them in motion. And this is just going to be our environment we live in for the next 2 to 3 years. So,
yeah. So anyway, again, there's going to be some changes for agents who are out there looking for opportunity. There's definitely going to be a lot of disruption, a lot of opportunity coming down the door, but pay attention. One of the things that our leadership at United has been telling us pretty consistently is get your agents out in front of their clients early and often this year, and kind of like set their expectations for the market. So when they get their ANOCs in their annual notice of change, for those of you who don't know what ANOC is, that's when they send out the notices for the upcoming
annual notice of change.
The changes for the upcoming plan year, and those are generally in September. When those go out, they want you as agents out in front of your consumers already and kind of preparing them to say, hey, there's going to be a little bit of some changes. You may notice a little bit of degradation of benefits a little bit. Don't freak out. That's pretty much going to be across the board. You know, the plans are still going to be good quality, sound, but you don't need to be jumping to the market to shop, you know, if your dental goes down by a few bucks.
Yep.
Or more.
So, yep, plan on that. And I don't know. I mean, I literally have been saying, I don't know, maybe I, you know, am unrealistic, but I'm not too worried about all that. You know, from our point of view, I'm looking at plans and what they were looking like in 2019 and 2020. And if I can, like I said, pull up my summary benefits or my sales kits from back years ago and pull those up, that's about what I'm shooting for or thinking. Now, there is that whole TBC thing with Medicare where they can only reduce or degrade their benefits by so many dollars. But I think it's, what, $80-something per something like that? I can't remember.
80, 85 is what they're saying. That
something
they're
dollars.
Like overspending on right now.
So I think that if you think about that on a basis of per member per month, that's about what I'm thinking carriers are going to try to be reducing to. And so, again, just that's my benchmark. And I think hopefully maybe I'm being too pessimistic and a little too sober. And maybe benefits are going to come out and I'm going to be pleasantly surprised. But I think I'm planning for the worst. And then if things are better than that, then I'm going to be pleasantly surprised.
Yeah, what we're hearing from a lot of our carrier partners is that there are still going to be carriers, a lot of these smaller, more nimble carriers that are going to still want to grab market share and be in growth mode. And they're not going to be hit by as many of these benefits. And then there are others that people are are generally saying are pretty exposed out there. They're worried about the Aetnas and the Humanas and things like that, with having to really pull back some of those benefits. And so it'll be interesting to see. I mean, there's always going to be somebody out there that looks like the darling, that's a surprise, that was able to weather the storm or wasn't quite as affected as others. And so we'll start getting a bigger picture and a bigger clarity of that.
Can we transition? Let's transition now with that environment into sales, right?
Yes.
Sales. I think that this is now an opportunity, right? Because we talk about that a lot. Hey, there's all this chaos, there's all this disruption, all these things are happening. It's all like, oh my gosh, it's doom and gloom and everything's negative. And from our perspective, always like in the midst of all the chaos is always like going to exist those opportunities. And in my experience in life, in business, and especially Medicare, every single year that there's new plan comes into the market, there's a SAR, one exits, this network's not part of this plan anymore, whatever that disruption looks like, in the chaos, there's all that wonderful opportunity. In particular, if you're a new agent just kind of trying to start your business and get going, this is a good environment for you.
Correct. And just so everyone's clear, a SAR, S-A-R, is a service area reduction. Basically, a plan has been in that area and it's no longer penciling out. They need to retract. They need to exit that county. And so it generates, generally, there's an annual enrollment, and then there's also an associated special election period tied to it as well.
Right.
Gives people plenty of time to find a new plan. But we anticipate there being a lot of SARs, especially in rural counties. And where Dan and I really grew our books of business back in the day was agents mostly want to work in their local metro area. If you're a local agent, most people want to work within a 15, 20, 30-minute
zip codes, counties, yep.
And we always were willing to go to the outskirts, so to say, to the more rural areas, to the counties where there wasn't as much competition, where people weren't focusing on it, because we found that
we might as well say, hey, I'm wearing the shirt too. Money's green everywhere.
Yeah.
That's why I tell people, it's like, hey, there's money. I'll drive. I'll go counties away. I'll drive for 3 hours. I'll do whatever. I can go do the math. I can go crush out 8 sales or 10 sales in a day. And like, I can do third grade math and go, I got paid $450 an hour.
Correct. And we both have clients that we put on people on plans in 2007, 2008 that have been on that same plan. I mean, I'm sure you have clients that have been on the UHC Plan 1 in some of these rural areas, and same with me. And so they've been on the books for 15 plus years.
Yep.
So what are the LTV on those policies? They're pretty dang good.
They're making up for some of the others.
Yeah, right. But the point is that we always were looking for service area reductions, disruption, right? Because whenever there's movement in mass one way or the other, and there's always going to be people who are shopping. There's always going to be people who are paying attention. So this upcoming fall, pay attention, your local broker market managers, your regional broker managers, and this goes for ACA and Medicare. Learn and then find out who's expanding. Is somebody exiting one county and somebody entering into that county? Look for opportunities like that.
The other thing that's happening is, yes, always the service area reductions. But again, so 2 things. We would always tell, and we still preach this to even our existing agents. We have this a lot. Let's say you're an agent listening and you have a significant book of business, 1,000 plus, 2,000, 3,000 clients. I mean, we have some really established agents that have been in the business for a long time. And when a plan disruption happens, or let's say there's one particular plan in the market that really significantly degrades their benefits, right? That block of your business is now at risk. And the agents don't like it either, because then they have to spend the whole entire open enrollment period, or AEP, annual election period. They have to spend the whole time trying to save that block of their business.
Playing defense.
Yeah, and we would always coach and say, but here's the opportunity. Let's say you have 300 of your members that are exposed. Not only are you going to get in touch with all those clients, provide that service that you should do, some of them are probably going to be fine and going to remain on that plan. Others are going to want to change, but that's that chance for you to ask for those referrals. If you are changing their plan, the chances are that they have a friend, a neighbor, other people that they know on that same plan. And a lot of times, those 300 members that they were going to lose, they retain almost all those, but they incrementally grow their business because they're out there getting more referrals, or they find the providers or the home health provider or the hospital group or whatever that was impacted, they figure out and build like a referral source of all those other impacted members. And they can say, hey, yeah, I had to go play defense and protect my 300 lives, but I actually ended up writing 450 policies. So I had a net growth of 150.
Find those niches. The riches are in the niches, right? So yeah, that's a great point. So kind of let's talk about a couple of types of marketing, because you brought it up before we started talking about active marketing, active sales, and passive marketing and passive sales. You want to kind of talk a little bit about thoughts and strategy there?
For those that actually view our podcast, instead of just listening, I keep this sample with me. Back years ago, we had this great idea, couldn't lose, for marketing and advertising with our Medicare Advocates, direct-to-consumer brand.
Yeah, we own a brand called Medicare Advocates, direct-to-consumer.
And the whole idea is we partnered with this marketing company that had a contract with all these pharmacies, right? And so we'd go to Kroger, Smith's, Super King Super, a bunch of them.
Yeah.
Anyways, we picked like 5 or 6 Fred Meyers. We picked a bunch of different pharmacies where people would go to pick up their prescriptions, and we advertised both sides of the bag in like 5 different pharmacies in multiple states. Spent a lot of money, and we had a text for help. We had great messaging, great content, great branding, and we thought every single person that's going to fill their prescription is getting a bag with our name, phone number, call to action. It's going to be awesome. And we got, I think, 5, 7 phone calls. We're talking.
I don't even remember getting any. So
I think we checked it, and this is from a very sophisticated model. And I'm telling you, we had a dedicated DID number, like a soft phone number for just that campaign. So we knew exactly how many calls we would get. It wasn't like let me check and see. I think we got this many. No, we actually knew the number of rings that we got from this campaign. And again, 10,000 bags in 5 different pharmacies in multiple states, over 50,000 of these bags that we paid, and we got 5 to 7 phone calls. And I think we converted 1 or 2 sales, period. The ROI was piss poor. We'll put it that way. It's a very sophisticated term.
A few $1,000s per lead.
It was very, very, very bad. And same with the other initiative we did, which we talked about once before. We advertised on Sirius XM radio, spent a significant chunk of money. I'll just put this. It's not cheap to be on Sirius XM. And I mean, we had it placed on all these segments. We worked with like the media buyer there. I mean, we had it on all of our segments, the History Roadshow, CNN, Fox, I mean, you name it. And any channel that you think an old person would maybe listen to, we were there advertising. Let's just say we got more phone calls than the pharmacy bags, but I think we also spent 10 times as much.
Well, a couple things that were funny about that I remember. We did hire a professional actor, and we had multiple versions of the ad. It was very good. The actress was great. The copy and script was amazing. And the funny thing is to follow the CMS guidelines with radio ads. We had about 60-second slots, and seriously, about 25 seconds of that
was disclaimer.
Were taken up by disclaimers on the. So you'd hear these ads, and it was this great, beautiful cadenced ad.
But they don't let you. So the difference with Medicare compliance, if you're slinging all these other things, you can speed it up and terms and conditions apply. And you can hurry and spit out 60 seconds of disclaimer in 6 seconds, and nobody understands it. With Medicare, you can't do that. So you have to have your disclaimers all at the same pace and tone of the rest in order to really be compliant.
Well, it was a little bit faster, but it still had to be, hearable. But I just thought it was hilarious that we would try to get these ads out. And the other thing that was, we were much smaller at the time, and the investment was significant for us. And the other funny thing was it was probably the worst timing scale-wise, because I think that was the first COVID year where everybody and their dog was advertising on radio and TV, and it was the height of the Joe Namath era and the noise, and it was a fart in the wind, so to say.
And even though it was a huge chunk of money, it was still And
I remember,
Whiff.
So multi 6-figure investment. And I think we had 11 total sales that we could trace back to it. 11
we probably
total
had 50, 60 calls and 11 but we had decent conversion rates, but not a whole lot of traction. And I guess the point that I wanted to make with that is that's what I would refer to as like more of like a brand awareness and like passive marketing, to where, you're really spending this money and you're hoping that your phone rings. And these are like really takeaways. If you're a broker listening to this, be careful about it. I think that there's phases of your business and as you're growing and scaling where you want to spend some money on passive marketing or brand awareness, but not when you have a limited budget and you say, hey, I have so many X amount of all-in dollars. You don't really want to be putting that into initiatives that are passive, meaning that that could be a newspaper ad, that could be a billboard, that could be radio or whatever. Anything that you're spending money to put a message out there and just hoping that your phone rings is a bad proposition if you're a newer broker and you need business now.
Correct. And it goes back to the concepts of marketing and sales, right? Like when you're marketing, you have to focus on reach and frequency, right? Like that's one of the things that we do with this podcast is we spend time on it every week. We put it out. We're going to be consistent. We're going to be dedicated to it. We're going to post it out everywhere where we can. Reach and frequency, and hopefully agents or agencies or whoever or industry people eventually hear it at some point and become aware of our entity, our organization, right? That's an example of marketing and reach and frequency. Sales are more of a direct, I got to get an ROI on this immediate ad spend, and I've got to go find a way, to Dan's point, not where, the fish are going to be jumping in the boat, but you've got to go out and catch those fish, and you've got to get an instant ROI on that. And that's a mistake that a lot of agents make, because it is difficult to get that brand awareness and that marketing. And
especially when you're talking about brand awareness too, you could have an agency owner out there who goes and spends $50,000 on brand awareness, and you're in a space though where you have payers or carriers trying to get brand awareness out there, or other larger entities, and your $50,000 is just swallowed up by somebody else spending $5 million in the same marketplace. And so it just is not very effective. And you're not going to get that bang for the buck. And we've actually had kind of like, and we really do, we do business planning with agents, and we map out and scope out, what is your plan? And we try to give people options and pick a path, execute your business plan. And that's been one of the biggest things that's been hard for us to watch, is that we want them to succeed. And you kind of be like, been down this road before. Let me give you my best advice. And they're like, Dan, I heard your advice, but I'm going to do this anyway.
Yeah.
And you're like, oh man. And they end up spending so much money on these initiatives that don't pan out. And then they're like, hey, I'm out of money. I can't do this. I'm out of the career, and I got to go get a job. And that sometimes happens. So just what, if you're hearing this, just be conscientious, especially when you're newer and you're just starting to build your book of business. Be putting your dollars into sales initiatives, leads, and other activities, which we'll talk about in a minute, that are going to yield you direct dollars back into your pocket and keep like the pipeline going, so to speak, and keep the business running.
Correct. A couple of common things that I see agents over-indexing on or focusing on from the beginning is, if you're a new agent getting into the business, doing Medicare, ACA, whatever, a lot of times people get very obsessed about their business name,
the brand,
their branding. And I'm like, dude, it doesn't really matter, because you're not, unless you've been operating for a long time in the market and spending all this money, no one's going to care if you're called, Rainbow Mountain Insurance or Rainbow, like people will obsess about that.
So to provide more context to what you're saying, Mike, and you're right, we see agents who are like, hey, I'm new, I'm getting in, I'm leaving this job, and I'm going to go all into doing Medicare or ACA. And they will have like a budget that they have created to kind of get them going, some seed money to get them, and they'll spend a bunch of money to hire and pay for a graphic designer. Instead of just going on to Fiverr or something or creating something cheap or whatever, they're spending a lot of money, hundreds or sometimes thousands of dollars on that. They're going to build their website first. Then they spend thousands of dollars on a website. Then they also want to create like publicated document, like publications, print, copy, all these things. Like they're building a brand for something much bigger than a solo operator. And suddenly they've now spent thousands, and even this is going on for a month or two, where people have spent 2 months of not selling, of focusing on their brand, their logo, their website, these materials, all these other things. And suddenly they're going, oh, I only had $20,000 of seed money to start my business. I spent $7,000 on expenses. I paid my bills and my mortgage and stuff. And oh crap, I'm down to $1,500 left. I got to sell now.
I got to go get a new job.
Yeah. And
that's what they do.
And we've seen that just a lot. So I guess the takeaway is, go ahead.
No, I was going to say it's funny that you brought up the website, because that's one that I see a lot of times people getting hung up on. And it's like, we know agents who have books of multi-thousand clients on the books who are Medicare millionaires, ACA millionaires, and they don't even have a website. They don't even have a business email, and it's like, my friend, you are the business at first. It doesn't really matter. You could go have the nicest, most beautiful website out there, but then how are people going to find you? How are you going to market? How are you,
and here's the other side of that too. I have other people who spend tons of money on overhead on a brick and mortar office. I have this beautiful office. It's amazing. I've spent all this money. Look how beautiful it is. And I'm like, great. Where are all your customers? Where are all the people? Where's all the traffic? Where are all the sales that are happening from this? And the same side of it, I know a lot of people who have, and I am guilty of this. I've had very, very, very small offices for years. Like some of them I owned the buildings, like personally. And so we would operate out, like, think about our Sandy office. Like I own that property, and that's kind of why we hung around there longer than we probably should, because, we didn't have a monthly payment, because I own the building. But, candidly, I know a lot of businesses that crush it, and you look at their storefront and you're like, it's not a whole lot to look at, but they're murdering it in sales.
Yep.
I would take that problem.
So storefront, because I think it could be a really good idea too. Websites, back to that, I do think it's funny. And what I generally find is a lot of these agents that are obsessed with building this website that does everything, what they're essentially saying behind the scenes, and this is, a chance for all of you to have some self-awareness and be introspective if this is you, is they're essentially saying, I don't want to sell. I don't want to interact with my clients. I don't want to prospect. I don't want to go out and find these consumers. I want to try to digitally market and drive all these consumers to my website that's so fancy that people fill this out, or I just generate all my own leads from it. And I will tell you that, early on if you were early in that space, that probably was effective. But in today's day and age, the sophistication of the digital marketing and everything being at scale, that's very, very difficult. I mean, we spend a lot of money, and to your point, you start competing for attention and lead gen and Google and clicks and Facebook leads and all these things and traffic and SEO. You're starting to compete with multi-billion-dollar entities at scale, right? And you've got to really do something that stands out or gets the attention and the tech. And it's become a lot more pay to play over the past 4 years than it has been. Somebody just staked their claim digitally and is able to be searchable on the web. And so I think that a website can be good. Of course, you want to have so my advice would be, get a good, easy, professional website that looks clean, that has your contact information. Maybe it has a simple web form on it, but all you're using that as a stake in the ground digitally, a presence to establish your legitimacy. Yeah. You just want to look professional. If somebody searches you up, you want to have that, backstop there.
And I'm going to say, just get a WordPress website, or do Wix or GoDaddy or whatever. Just build a simple website that works. You can pay a little bit, have it look nice. You can use your color schemes that you like and your logo, and talk about the services you provide. And do your plugins with what you call it, Calendly. Go ahead and sync up your Calendly where people can book appointments and request you and message you the business. And those things are very cheap and easy, and you don't have to go pay somebody $5,000 to build you a website. And candidly, I'm just telling people, you are not going to outrank and out CEO or SEO all these huge conglomerates. And the other reason I say that is, there are certain services within Google with their search console and their analytics and everything else that is pay to play. There are certain features that don't really become available to you unless you're spending over $50,000 initially or per calendar year. And so those other bigger advertising firms have those capability and analytics and data matching that you won't have on your SEO. And then same thing with like Facebook. It's become, and I'm not telling anybody out there trying to discourage you and say you can't do it. Like, yes, I know I'm going to get like hate and trolls and all the comments. And
I have this and it's successful for me. And
as a generality, 1 in 1,000 of the agents that are out there trying to run their own pages are having success, but 999 agents out of 1,000 are not. And same thing, Facebook has done some things where, you know, in Apple, we're trying to pretend like we honor people's privacy now, which I think is funny. Like, oh, we're able to pillage everybody for decades, and now we're like, oh yeah, we did this Apple iOS update. Now we respect your privacy. You used to be able to like very directly upload audience lists and target that specific group in Facebook. You can't do that anymore. And so you do have to, there's ways to build your lookalike audiences and to target them and do your split testing, and you can still be effective. But every dollar of your campaign isn't hitting your target. So
well, nowadays, I don't even think they need to do that when you are trying to market. Their algorithms are going to serve you up the content and the stuff you're interested in, right? Like you talk about, you know, you mentioned erectile dysfunction medication to somebody. I'm going to get a bunch of ads for it now.
Crap, my phone's on the table.
Yeah, and then all of a sudden,
me.
so now Facebook, Google, everybody, all the affiliates, everybody knows that this guy out there is interested in this, or this, and they don't even need you to like upload a target audience necessarily, because they're like, who are you trying to match up with? What kind of consumers? And they can very sophisticatedly match you up with those consumers and the algorithm already. And so we're dealing with that right now as we're trying to grow our web presence, and we are spending and investing a lot of money, and these things are becoming increasingly difficult. It's a more sophisticated game to play. But to Dan's point, we do have agents. We have an agent that runs a Facebook group. Mm-hmm. There are people who have invested time and sweat equity into building these digital infrastructures. Mm-hmm. You know, if you look at in our industry, you've got guys like Justin Brock that has built Medicare, not Gurus, Medicare Monsters now. Yeah. And that helped build and propel his business. And he put a lot of time and effort into putting out free content, answering questions for agents, and built a community and really
ecosystem.
It was committed to it for 4 years. You have, you know, Medicare mentors and, you know, Christians, 7-figure, a couple other groups out there, right, that have done a good job of that. But we have agents on Facebook who have built a group. We have an agent who answers questions for Medicare in a very...
He just created a group that was just like for Medicare beneficiaries to say like, I'm an agent, ask me any of your questions, and he's built a whole community. And same thing, sweat time and equity of like building his footprint and answering and responding to questions and comments. And then the more engagement, the more it's recommending. And, you know, and he's been doing this for a year plus, and he actually has thousands of people in the group. And it is possible, and it's very doable. And the reason that we're bringing it up is because we don't feel like it's a secret sauce or anything else. It's a model that's out there that's replicatable, that somebody can do. And I think it's much more sustainable with a much better ROI than trying to just throw your dollars out there and compete with the big boys.
Yep. To that point, we have a Facebook group that we've done a crappy job of marketing over the past 4 years, despite everything else that we've executed on and done well. So join our Facebook group. It's called Medicare and ACA.
Oh, so you're advertising that before the like and subscribe for the podcast?
Yeah, actually, no, the link to the Facebook group is now if you're watching this on YouTube, it's now in the description below. And as a reminder, Matt, like, subscribe, comment, ring the bell, yeah. It's making a difference. If you hear that little ring that Matt will add in here, go subscribe, please. Again, on Spotify and Apple, leave us a review. But back to the groups and the communities and things like that. The point is, and the moral of the story is, there certainly are things you can do, but you need to invest. Like we always say, you have time or you have money, and you can invest in building a group, and you can invest in marketing it out there and building it brick by brick. And what a lot of people want is they don't want to build anything with hard work and building it brick by brick. They want to have a shortcut. They want to throw a couple dollars at it. They want it fast and easy, and they don't want to have to go in and dedicate hours and hours and hours of resources to building these things.
And the other thing I would add, and kind of as we're having a sales discussion and really talking to more brokers out there listening to this, is remember, you're the business, just like you said. A lot of times when people are buying, you think about the services and all the insurance agents out there and all the different carriers and product, there's a lot of things that are very commoditized about the business, meaning that is there really going to be that much of a difference as someone is on an carrier A versus carrier B product? Their copay differential might vary by $50 to $100 over a year. You know, what's going to be different is the experience that they have with it. Mm-hmm. And a lot of times they're buying you, the agent, as much as they are the product. And we train and teach agents this and said, remember, they're buying you. And you need to build a rapport with the client, you know, have the correct, like build that rapport, have that relationship, invest into your clients and having that relationship. It's very frustrating to me when agents aren't understanding like their role that they're playing in the market, and that they're trying to avoid their clients. They don't want to have the interaction. They don't want to have the work. They don't want to service the client. They just want commissions. They want to make a buck, and they want to get paid forever, but they don't want to invest in them. And I said, you're making a huge mistake, because again, the more that you're invested in your client, the more that the longer they're going to stick around, the better your LTVs are going to be, and the more referrals that you're going to continue to get. And even when those annoying clients of yours that call to bug you, those are opportunities for you to build the relationship, get referrals, and earn more money.
Yep.
It's shocking to me.
Yeah, to that point, you know, I always coach agents and I say, instead of you getting annoyed when your client calls you and has a question, look at each time you help that person, each time you talk to them, as one more stake in the ground, one more reason why they're going to stick with you for a long time. Now, of course, we all get clients that have crossed that threshold to where it's like, dude, I don't know who you're going, but you're not my client anymore.
The
you know,
the $25 a month I'm getting is not enough.
Yeah, this is a losing proposition on this, because but then there are other clients that we've done, you know, you do a good job with, and they value your time and expertise so much that I could be like, I hate you. I want you to change my plan. I don't want to be your agent evermore. And they'd never leave you because they know that you did them right and spent that time and invested in there right from the very beginning. So
I've been shocked too, and I'm not trying to call out other organizations, but there's also organizations out there that are like, hey, agents, let's have you not do any service work with your clients. We'll do the service work for you. And I'm kind of going like, well, then what value and how does a carrier like that? Because isn't the whole point of an FMV commission is that you're paying the agent to service the member and to explain the product and to answer their questions and to be somewhat of a buffer and to provide some ongoing services and things like that for the client. So then the agent wants the commission, but then doesn't want to like do the servicing work that comes with it. It's counterintuitive to me. And it's interesting because, you know, you're really saying like, I don't want to be an insurance agent. I just want to get paid like one. Yeah. And again, that's the name of the game. And the more we go into sophisticated models, consolidation, bigger entities competing, for all you independent agents out there listening, you need to go deeper with your clients. You need to build stronger relationships. You need to start offering the services. So we have one good agent who does a really good job in building his clientele. And when he meets with them, he will start saying, here's who I am as an agent. Here's my years in the business. Here's all the services that I provide for my clients. I educate you on these things every year. I'll do a review. I'll do my touch points with you. You can call me anytime. And he goes through and he starts talking to them about the 6 or 7 bullet points of all the services that he's providing them before he even gets to, you know, the product and the pitch or anything else. And he tells all his clients, if you're not looking for an agent long-term to help you with all these services, you just want a transaction, somebody sign up, I'm not your guy. Go find another insurance agent. I'm looking for clients that I can work with and build a relationship with and have a clientele. And if that's not you and you're looking for me to just sign you up for a plan, I don't need your business. Go find somebody else. And by him...
The takeaway.
Yes, by him doing business that way, his clients stick forever with him because he's built in all of the value in him as an agent and all the services he's providing. And the carrier and the product that he's offering them is secondary. They're more loyal to him and him as the agent than they are the insurance product that he's recommending and putting them on. And for all of you agents listening, that is a very good, valuable lesson and takeaway for you to have as well.
Yeah, I think we've all, if you've been in the business for a long time, there's been instances where people have said, hey, well, if you can't become my agent of record, or I want you to be my agent. Sure, I'll switch plans, or, if something, a lateral movement, if I can get you as my agent. And we've had agents that do that before. I've done that before, where clients just really wanted me to have them be in my book of business and represent them as an agent. And so they've been great long-term clients. And, I think that as time compounds and the more outreaches and the more touch points you have, and you're building these relationships with clients, the longer and the more likely it is for them to stick with you, and you can do that even if you're doing business remotely, right? Like, I have a lot of clients that, even though I've tried to, I don't know if I say pass them off, but, move them to our retention team, and have them help, they'll still call me, and I've never met these people. They're
right.
I sold them virtually years and years and years ago.
You have a lot of really good clients in Hawaii.
Yeah, yeah.
That they still just love calling you.
Yeah, and tried to meet up when we were out there. And
that's true.
Yeah, and so, yeah, great.
Legit, for any of those carriers paying us commissions for Mike's, sales in Hawaii, he literally was out there and, was message him back and forth, and we're like, yeah, let's meet up.
Yeah, also IRS, take note, just in case there's some write-offs there. But yeah, I think that to that point where we've talked about what agents can do with websites and storefronts and things like that, but ultimately what we're seeing a little bit of a shift in, I feel like, coming out of this post-COVID world, coming out of this post, the digital and the way that all these regulations are changing, a lot of people have said, well, it feels like we're going back in time, marketing-wise. And I think that's a pretty accurate description, and one of the things we've said on this podcast multiple times is that marketers ruin everything. And, all of a sudden we burn out a certain marketing opportunity or technique becomes no longer viable. The return on it, or the return on time, or the return on investment is no longer penciling out, and you need to shift. And so I think that, if you're an agent out there, maybe you need to think old school a little bit. And the benefit of that is you're going to get good quality long-term clients. You're going to have a lower acquisition cost, and there's some really smart, intelligent things that you can do to go back and build a client base.
Do we have time for me to talk about 3 low-cost, effective marketing strategies, or how much time do we got, Matt? Where are we at?
12 minutes.
12 minutes. All right. So couple really good ones for you listening. Like, hey, again, we've kind of been talking. We want people listening to the podcast to have some actionable takeaways and good things from this. So a couple things I would do, if you're a seasoned agent out there and you have a block of business or a book of business, and you're a local agent, one thing that's very cost effective and works very well is doing member retention meetings during AEP, where again, you host an event somewhere. Again, follow all the formal and informal sales meeting rules and guidelines, but do member meetings, right? Whether you're using a movie theater, a venue of some sort, you're drawing all of your clients in and welcoming them to come see you in person, in the flesh, shake hands, kiss babies, do all that, and have them bring their friends, neighbors, family members. It's a great way for you to effectively service your members and write them on a policy, and also grow your book of business, because if you're, again, presenting yourself with all the services that you're providing people, you will be able to get other friends, neighbors, family members who are like, oh, I haven't heard from my agent ever. I don't know who my agent is. I don't get that kind of service. And it's an easy way for you to grow your business.
Yeah, I'm just smiling because it reminds me of back in the days when we used to be able to do community meetings and pay for meals and things like that, And
those good days are gone.
And United would generally market those. And we have an agent who's now one of our good agency partners, and he was notorious for sending his clients to your meeting so you could pay for their meal and get the updates, because that's how it used to be. Is everybody wanted the industry was trained to go to a local or as many of these meetings as possible, eat a meal and learn about the updates for next year, get a slice of pie. And it used to be even full meals back in the early days. Yeah. And so he would send his clients to your meetings to go get the update on your dime. And then you'd go to try to help them or something. They're like, oh no, I'm with this agent already. He just sent me here to learn the updates. And I'm like, Oh, thank you for sticking me with your $100, $200 bill for your client's food,
For 8 clients. Yeah.
But it's working smart, and he built a massive book of business, and so
That's a good one for everybody. The meetings.
You got to be careful with that. You got to know your clients are loyal if you're sending them to the enemy's pitch meeting, right?
No kidding. Another, I would say, very good low-cost initiative for people on a budget is, again, working the D-SNP population in the food pantries and the food banks. And there's kind of an art to it, and we'll probably go through more trainings and look for like YouTube videos from us on how to do this, and we'll go in depth more. But a lot of these food banks and food pantries, they get a lot of donations for actual food, for these perishable food items, canned items, things like that. But what the people coming in, they need a lot of time are feminine hygiene things, tampons, diapers, formula, other things that they don't have, toothbrushes, toothpaste, they don't get those donations. And so I would always go to those food banks and say, hey, like what are your needs that you actually, okay. So I would go spend hundreds of dollars and then give them that donation that they're looking for. I would sometimes volunteer hours at the food pantry, get invested into the opportunity, and I would spend some time and some money. And by the time you're really building that relationship and partnership with that food bank, you're going to have a lot of those D-SNP selling opportunities, whether you can set up a booth, whether you can have a private room to meet with people, whether you're on their intake form and you're helping them with consultations. There's a lot of business to be written, but the big key is you have to be invested, put time and money and care about that nonprofit and about those people in order to make it be successful.
Yeah, correct. That we've had great success with having agents or training agents how to actually volunteer and do the intake forms, because a lot of times those food pantries are trying to solve and deliver solutions for social determinants of health. So a lot of times if someone has food insecurity, you're asking them questions about their income, about their health insurance. And then of course there's obvious, if you're filling out an elderly individual that qualify or could qualify for a D-SNP plan, that you could give them a food card, a gas card, or whatever. It's a very easy value prop to work with those food pantries and, draw the connection of how you're able to better those people's lives, because ultimately the food pantries and a lot of these other organizations, they're trying to solve food insecurity. They're trying to get people solve those immediate critical needs and get them to that next level of life. And in a perfect world, that's how these systems and that's how these products are designed, is to help people not always stay in that same socioeconomic system, but be able to kind of solve and get out of some of those predicaments.
Yep. The last thing I would probably want to talk about, and we'll probably run out of time, but I have 100 different sales initiatives that we've either done, implemented, had success with. And like I said, we're going to kind of release those, tidbits, throughout our podcast episodes. But the other one is, you have all these extra ancillary benefits, and we've told people to go ahead and have like these member parties with your clients. So let's just pretend if you're a local agent and you've sold, I'm just using examples. Let's say you've signed up 100 people within so many zip codes on, a Humana Gold plan that has a dental or like an OTC benefit or whatever. We'll coach agents to go ahead and do like member parties with their own members and explain to them, maybe it's OTC catalogs, how to actually order things. And there's a lot of utilization or benefits with their plans, whether it be a flex card that they have, whether it be the United Healthcare grocery card, whether it be the spendables with WellCare, whatever it may be. There's these ancillary benefits. Look, we know they're going to get cut next year, but there's still going to be some of these ancillary add-ons. And so we coach agents to group together their members and actually provide value and show them how to access and really use these benefits. And same thing, bring a friend, bring a family member, bring a neighbor. And you're finding that 20, 30 people show up and only 15 of your clients, and they're like, oh, I don't have that Spendables card. I don't have that
Correct.
OTC benefit. How come? And there's a lot of, you kill two birds with one stone. You're providing value to your clients, and you're also picking up new members. And these things don't cost you a lot of money. They cost you time, effort, planning. That's what it really costs you. But if you're doing that, and let's say you're getting your members on 90-day mail order, you're enrolling them in how to download the app of the carrier that they're on. They're knowing how to look up their claims data. The more and more of these services that you're getting your clients to utilize, the stickier they become, the longer they're going to remain on that particular health insurance plan, the less they're going to want to change to another plan. So these are all very, very important initiatives that people should be doing. And again, cost effective, time, effort, planning, execution.
Yeah, just to add on a little bit to that, what I've seen really good agents do is if they've grouped together, enough people on a particular carrier, so invite the local broker managers out. And a lot of times these broker managers will come out and they'll bring their stress balls or their pill boxes or their swag that they're going to give away. They'll set up a little tent. They might even provide them a little, food, donuts, things like that.
Not to exceed $15.
Not to exceed $15 per person. Don't come at me. And those of course, agents know the rules and the broker managers know the rules, but it offers value to those clients, and it offers value to the broker managers because, they have to report what they're up to, what they're spending their time doing during the day, and they're doing member retention meetings and helping agents and doing development and market dev. So there's all sorts of things that we can do, and we'll parlay back to or pivot back to doing some more very specific trainings on these different initiatives and kind of like step by step how you can do them, how to set them up, how to offer the value, and how to really capitalize on those opportunities.
Yep. So I think we're probably at time or close to it, but yeah, just look for an episode upcoming from us on kind of step-by-steps, like a how-to guide. If you were like a brand new agent and you were starting from scratch and you had to, get going right from day one and your first 90 days and your first 6 months and your first year, I think that's one of the episodes that we're probably going to create so we can go back and kind of give more of a structured outline on how to do that. But anyways.
Yeah, a lot for this week, kind of a little bit disjointed, a little bit of news and a rambling, and then some marketing tips and updates. So appreciate it. We'll wrap for this week.
Agent Boost.